Okay, now it's recording. Uh, I'll just ask this question because it's top of mind for me right now. Because in my neighborhood, I live on the South Hill. I see all these signs in front of people's yards that say "We support Dr. Lutz," and well, I'm just curious of your thoughts on that.
Yeah, it's pretty overwhelming, Mark, to see all that support. We actually stepped away for a couple of weeks and then came back and started noticing these signs popping up. And it was just really touching to get to experience and to hear and to appreciate the support that is visible, but also is palpable. I mean, Amy and I have had so many people reach out to us at many different levels. So again, it's really appreciated.
How has the last month or so been for you, Dr. Lutz?
It says, I'm connecting. Hey, Mark, let me do this. Let me send this to a different computer. I'm going to send a link to a different computer, okay?
Okay, sounds good. I'll just stand by here.
Because yeah, it says I'm having problems connecting. So let me just try a different computer.
Okay. Hopefully, like stop that from streaming. Maybe if you don't mind, just for a few minutes. All right, I got you.
Here we go. It's also a better camera too. The other camera that I have in the other computer is not really good. It kind of whites me out.
Yeah, I hear you. No, it seems like the connection's better. So thanks for doing that.
Definitely. Good.
I'll just pick up where we left off, if you don't mind.
And so we're in the South Hill.
We're on 21st and just like 2 blocks in from High Drive.
Okay. Yeah, we're on 27th,
Oh,
between Bernard and Howard. I noticed I'm looking at your entranceway, which is the same as ours. I was looking to see the setup. It's a little bit different, but the house, obviously, all these homes are pretty similar.
yeah. So there's our entranceway. I can walk around a little bit. Let me see here. There's our doorway in.
Oh yeah, yep.
Then there's our living room, which you can see behind me.
Right.
Then
nice.
there's a bedroom back there, and then we actually just redid our kitchen, so we opened up this archway right here.
Oh, good for you.
Yeah.
Yeah, and you went with the round archways, which is sort of real characteristic of the homes up here.
Yeah, they're so cool. I mean, there's always a can of worms when you want to work on them, but a lot of character.
Well, it's funny, when we moved in this home, Amy spent the first 9 months scraping paint. She we had when she got down to the woodwork, it's all mahogany.
Yeah.
And so, but it was all oil-based paint.
Yeah.
And so she spent 9 months stripping paint, and then she used dental tools to get in the fine lines of the woodwork. So yeah, she spent a lot of time. I was working. She spent a lot of time.
Yeah. Oh.
Anyway.
We just funny. We just redid our original hardwoods in our living room, and then in our kitchen, we tore it out under the laminate they had over it. We found the original fir floors. It's so cool.
Yeah, and it's interesting they use fir because it's so soft. But
I guess the reason behind that is that, like, if water gets on fir, it doesn't swell like the oak would. So
okay.
Yeah,
it's interesting. Yeah, so same with ours. So we have fir floors in the kitchen, and then the steps are all oak.
Yeah.
For the wear and tear, but we have dogs, and so the dogs have done wonders in 15 years while running to the back. Yeah, so probably need to
Right.
get them done at some point.
Right.
So
Uh, cool. Well, Dr. Lutz, I think before we switched cameras, I just asked you kind of what has the last month been like for you?
yeah, Mark, definitely it's interesting would be probably the best adjective to use. It's just, a lot of ups and downs. It just, there have been some highs and some lows. Certainly, as I mentioned earlier, Mark, the amount of support that Amy and I have received has just really helped us immeasurably during the last few weeks. But it's, it is what it is. You can't really fight it. You just have to accept it and work with it.
Mm-hmm. Now, I don't know if you're at liberty or if you don't want to talk about what happened in the past, and I understand that. Um, is there any news to report in terms of that?
Not at this time, no.
Okay. Let's move on to your new role. Has this been in the works for a while with the state?
It's certainly been conversations for a couple of weeks, yes, Mark. And I think truly the details will be worked out. It was announced yesterday, essentially Dr. Lofi, the state health officer, stepping away on the 22nd, Dr. Shah, the new Secretary of Health, coming on board on the 21st. I'm onboarding on the 16th. So there'll be some overlap between me and Dr. Lofi. Dr. Lindquist, who is a state epidemiologist, he and I will be working very closely with Dr. Lofi to ensure that all the good work that she's been doing, we're going to be able to continue that work. And then my direct supervisor will be Lacey Fehrenbach, who's the deputy secretary for the COVID response. And so the focus of my work will definitely be around COVID-19.
Mm-hmm. Will you be working remotely from here in Spokane, or are you moving over to
Yes.
the west side?
No, I'm staying put. Spokane is home.
Okay.
So we actually just got this big box of stuff today. My cat jumped in the box. She's really enjoying all the packing paper. And then we're just trying to figure out how to reconfigure a basement corner for an office.
Yeah. Yeah. Speaking of COVID, I mean, obviously, as you know, cases right now are just going gangbusters. What do you think about the current situation with COVID-19 in Washington, and in particular in Eastern Washington?
Yeah, it's disturbing. It's concerning. Certainly in Spokane, as you know, if you look at the curve, you've never really seen a decrease of significance. Gosh, we had a little bit of a downturn during the summer, but for the most part, we've just been on this sort of gradual rise. And then, after September, it just sort of exponentially blew up, and we continue to see a real significant increase. Spokane, but also Eastern Washington. Right now, as you probably know, King County, Pierce County, and Spokane account for probably 52% of cases in the state. But you also have just really high incidence rates in Northeast Tri-County, down in Asotin, in other counties. And, it's tough. It's tough because with those cases come hospitalizations. And just looking at our numbers today, if I look at the 4 Spokane hospitals and include Kootenai, we have 218 COVID-19 patients in those 5 hospitals. And that's just looking 218, and I forget how many, 18, 26, 26, 30, almost a little bit under 40 in the ICU. So Spokane and the Inland Northwest has never seen this case count. And it's just, although obviously we know, I should say, physicians and hospitalists know how to take care of patients better, you still know that if you end up in the hospital, your risk factor for significant problems, both in the immediate and long term, are enhanced significantly. So it's of concern, no doubt about it.
Do you have, I guess, I don't know the best way to ask the question, but do you feel like Spokane Regional Health at the moment is handling the situation good or poorly, or could they do better? What are your thoughts on that?
No, I think, irrespective of me not being there, Mark, the professionals at SRHD, they always will be doing their best work to ensure the safety and the health of the entire community. So irrespective of my absence, I mean, they're doing everything they can, but it's not just the agency, it's not just the public health professionals, it's everyone collectively that needs to be really working because, what they're doing is providing the guidance, providing the epidemiological investigations and recommendations, but it really comes down to what people are doing. And COVID-19 is very behaviorally sensitive. And if people are not following all the mitigating recommendations that have been in place for months, then unfortunately COVID-19 takes advantage of it.
Mhm. You told me, it's a bit redundant, so I apologize, but you told me in terms of your new role, kind of what you'll be doing, but what, like on a day-to-day basis, kind of specifically, what will be your job? What will you be tasked with?
Yeah, I think that's still to be determined. We just got, as I mentioned, this Christmas package of all this new computerware, and we're trying to figure out how to get it going. But Amy already notices that there's meeting invites on it for me starting next week. So I think a lot of it will be sort of flushed out as I learn what are going to be the priorities that are going to be delegated to me versus to Dr. Lindquist, and how we'll sort of divide up those responsibilities.
So I guess the bright spot in terms of the news this week for COVID is that Washington should be receiving its first batch of doses within the coming days of this Pfizer vaccine. What are your thoughts on that? And I guess, in your opinion, how long or will it take before the vaccines have a meaningful impact on reducing the transmission of this disease in Washington?
We're gonna, from what I understand, Mark, we're probably going to see, at least of the Pfizer vaccine, from what I understand, maybe 220,000 plus doses. And again, that's 2 doses per person. So that's 110,000 individuals who will be vaccinated. We know they're going to be sort of prioritized for those high risk employees, high risk healthcare workers. And then you're going to see more gradual rollouts. Washington State, and again, I'll learn more once I'm actually involved with the work, but we will be receiving weekly allocations of vaccine, first the Pfizer, then hopefully the Moderna, and then other vaccines that are in the queue as they get EUA. That said, you're still looking at a significant percentage of the population that has to be vaccinated to get that herd immunity, which is projected to be around 70%. And so 70% of 7.8 million people, that's a lot. And so I think what people need to think about is that, yes, vaccinations are one thing. We also have to be concerned about vaccine hesitancy, because obviously there are concerns, for any number of reasons as to whether or not the vaccines are safe. Everything to date that I've seen, that I've read, has suggested they are safe. Side effects, sure, but safe so far. And I think we need to get people comfortable and confident that the vaccines are the way forward. In the meantime, however, people need to still remember that those mitigating recommendations that have been in place for months, staying in small groups and really trying to, keep distance and wearing face coverings, are going to need to be our norm going forward for a number of months.
Mm-hmm. I spoke with Dr. Anna Wald from University of Washington earlier this week, and she was saying that we'll probably be wearing masks for several months, perhaps even a year from now.
Yeah, I think that's a very reasonable expectation. I think certainly what I've read, again, we won't really see numbers of vaccines into the general public, probably, into the early spring months. And so we need to, again, continue to do what we've been recommending. That really is the only way to really kind of keep the pandemic at bay, or at least try to get it under control.
I just wonder for you personally, what made you want to stay on kind of in the public health realm after what happened here in Spokane, but stay on in this fight against COVID-19?
Have you ever read a book and then all of a sudden you stop midway and you don't know how it ends?
Yeah.
For me, Mark, I started a job. I started back in March, actually back in January, February, when we started standing up our incident command. We started looking at what we were going to have to do to address the pandemic. Very involved with it from the get-go. and then to all of a sudden have that, if you will, that job, that responsibility half finished, that was difficult. So for me, this is a job half finished. This is a book half read. And so I really want to be involved. This is my community. And I really want to ensure as much as I can as one person, the safety and well-being of every community member. To be able to do that also at the state level so that I can really have impact across the entire state. That's why I do it.
Mm-hmm. If the door opens at some point down the road to return to your previous role with SRHD, would you be open to that?
It's difficult to speculate on this, Mark, right now. I think for me, the job at hand is what I've been asked to do, to really look at how I can help the entire state address the pandemic. And we'll just take one day at a time.
When you, obviously I'm sure have just analyzed the pandemic situation over and over and over again. But as you know, there's no like overall nationwide guidance on the pandemic that we've gotten from the current administration. So I've heard this analogy, and I apologize if it's a bit crude, but I think it's kind of accurate. It's like asking 50 people to get in the pool and say, you just pee in your square, you pee in your square, you pee in your square. And that's kind of what our different states are dealing with right now, especially in communities like Spokane, where people can drive a half hour and be in Idaho, where there are fewer restrictions.
Right. Yeah, I think we have been challenged by the lack of a cohesive, well thought through national approach to COVID-19. So it's 50 states. And then even within states, it's oftentimes patchwork, depending upon any number of factors. And so, yeah, I think, unfortunately, the history books that will be written will say that the United States had probably one of the worst, if not the worst, responses to COVID-19. My hope on the other end of this, however, Mark, is that we learned from what we did wrong. Because again, there'll be more pandemics. There'll be more pandemics. This is now the third corona infection like this, corona pandemic, in the last 20 years. So it'll happen again. We have to be better prepared. And if nothing else, I think this has shown that the public health infrastructure needs to really be bolstered. We go from one emergency to another, and lessons learned cannot be lessons forgotten. And we really need to learn from this experience. What did we do right? Of which I think there are many things. What did we do wrong? Which I likewise think there are many things. And let's not repeat those mistakes again.
Yeah. The next 2 or 3 months a lot of folks are saying are going to be pretty difficult. Is that kind of your assessment too?
Yeah, maybe. I'm reading the same information that everybody else is. I think certainly, if the projections are what they have proved oftentimes pretty accurate, then yeah, I think the next couple of months will be very, very telling. As people are staying more indoors, they're going to get together, gather with people that maybe they shouldn't because they feel safe. If almost 1 out of every 2 people that have COVID-19 have no symptoms, then it's a real risk when you're gathering with people who you don't necessarily know, or even if you do know, you just don't know. Mm-hmm. And so, yeah, I think we really have to be very cautious about the next few months, the next few weeks especially. Mm-hmm. And then again, people need to look on the bright side. The fact that there are vaccines, the fact that this is encouraging, and the fact that there are things that people can do to get outside and spend time with loved ones inside and get outside with family, get outside. In Spokane, you've got the ice ribbon that's opening up. You've got the parks, go snowshoeing, get outside and enjoy the time, enjoy the space. Outside is safe, as long as, again, you're providing the distance between people. So, and again, I think that, yes, it's concerning, but I'm also encouraged because, again, I think that we need to get through this. We have to be resilient. We have to get through this. And we will.
Mm-hmm. Yeah, I think a lot of folks are thinking, hey, the vaccine's out, we can go back to normal, but the reality is it's going to take time.
Not yet.
Yeah, not quite yet. I guess from my perspective, it seems like at least Washington is pretty aggressive when it comes to how it's approaching the pandemic comparatively to other states. And that seems to be at least for me, a good thing.
No, right on, I agree. If you look at nationally, for example, when you look at total number of cases, Washington rates 46th out of 50. I think Governor Inslee has been very evidence science-based. The Department of Health, I think, has done an outstanding job. Both Doctors Weisman and Lofi leading the effort. I think, again, commendable work that they have done, and the entire staff at Department of Health and all the local jurisdictions. Mm-hmm. So again, I think that work has really kept us relatively safer than many other states across the country. And again, it comes from good leadership, pure and simple.
Mm-hmm. Dr. Lutz, I really appreciate your time. I have just kind of one more question, then we'll get rolling. But I just want to make sure, it was like kind of the first question I asked you before we switched over to the different cameras. So I want to make sure I ask again so it's
sure.
Camera is clear and sound is clear. Just from my perspective, when everything went down with SRHD, I think it was late October, just the number of people that reached out to us upset about how that was handled, I think is just a compliment to you, really, and to how many people do and did appreciate how you handled it here in Spokane. And what do you think about that?
Well, Mark, I and my wife were both overwhelmed by the amount of support expressed. It was very touching. Certainly during sort of the trying times that we've experienced over the last couple of weeks, knowing that we have that support, as you mentioned, seeing the signs, we support Dr. Lutz. I get verklempt when I see those. That means a lot. I have people come up to me, and the sweetest thing the other day, Mark, this little boy I see walking up my stairs outside. He knocks on the door. My dogs bark, and he goes, "Are you Mr. Lutz?" And I say, "Yes." And he's wearing his mask and he's got his jacket on. And he goes, and he hands me a little thank you card. And it was spelled THANKS. And in the inside, he had written in his own handwriting about thanking me for keeping him safe and keeping the community safe. What can you say about that?
Yeah.
New neighbor, never met him before, lives down the street. He walked the entire length of the block to give me a card and then walked away. So sweet. Yeah. So again, that's very touching. And that's, you asked me earlier, why do you do it? I'm not in it for self-edification or self-gratification, but those little attaboys, those moments make you really know that you've had an impact. And that's what ultimately, I'm here to keep my community safe. I've done my best. I'll continue to do my best working for Department of Health.
Dr. Lutz, thank you so much for your time today, sir.
Pleasure. Thank you, Mark.
Really appreciate it, and hope you have a great weekend.
Likewise. Cheers.
All right. Take care.